Today at the Eastside, I should say legislative water and soon to be coffee coming at the Eastside. And I apologize for that. This legislative breakfast today is sponsored by the hospital, so I'd like to thank our sponsor. I'd like to thank NEK-TV and Todd Pronto for coming here to all these. I've missed him the last couple times, so I'm extending an extra special thank you to him today. And I'd like to thank all of you for coming today on this beautiful spring day. And the first person we'll have come up, as we always sponsor, we have Tom Frank from North Country Hospital. And we'll have him come up. Now, there's no microphone, they're recording it and we'll be able to pick it up, just have to project a little.
I don't need a microphone. Thank you. So good morning, everyone. I apologize that we don't have breakfast and drinks for everyone, and it's not because the hospital's going bankrupt. Just so you know, that has nothing to do with it. So welcome, thank you all for coming. It looks like we have a good crowd. Thank you to our legislators for coming today. Just want to say that things are going well at the hospital. We're doing much better than we have in recent past. The entire senior team from the hospital is here to join us today. So I want to thank everyone again for coming, and I'll turn it over to these guys.
Okay. And the first scheduled speaker today is Senator Russ Ingalls, and he is on the Senate Committee on Institutions. He's the chair of that committee.
No, chair of agriculture.
Oh, no, again, you can't trust the internet. And this...
I'm chair of agriculture and Senate institutions.
Okay, they had you on transportation also.
Well, I was once upon a time.
Okay, well, thank you. Here's Senator Russ Ingalls.
Thank you everyone for coming again. I'll say it every time that we're here. Government does not happen unless people show up, which we're very appreciative of it. I want to thank the hospital for what they do. I was thinking about this morning about, everybody's got a hospital story. Like 99% of them are all positive as far as how things go, and you don't have very many businesses that you have like that. And what they do for the area as far as their wages, health insurance, community sponsorships that you see everywhere. There's not anything that major goes on in the hospital as it's supporting. But again, it's not only just that. The biggest part of it is that if you're not healthy, you go there and they make you better. And if they can't make you better, they make you comfortable. They do all that they can do. We're very, very fortunate to have not only a hospital, but an employer like North Country is in our area. So thank you for all that you do for the community, for all of us, and thank you for making us better. The legislative session is probably a month away from being done, and I know that we all, the public wanted us to focus on a few things. They wanted us to focus on affordability, education, and public safety, and it's going to be a little bit of a rough year, I think, as far as for some of that, which is unfortunate. But we did get some bipartisan support to keep the education bill alive in the House. We had some Republicans jump on that to make sure that it passed. It probably would have passed all by itself, but the governor is very, very insistent on no matter what type of bill that's over there, And I don't think that there was a lot of favorability on it. I think there was even a lot of people, you know, on the majority side of it that didn't really think that that was a bill that was going to fix education in the way that we needed education to be fixed. But I think that everybody wants the conversation to go on, because if that didn't go on, well, then there was no need for the Senate to take it up and try to make it better. We have a long ways to go on it. We really do. A long way. So hopefully the Senate will keep on talking about it. It sounds like they're going to probably be there after the session. If I was a betting man, I bet that the majority of the legislators are going to get out on the third week of May, maybe the 1st of June, and that the education committees will keep on talking and keep on working on it. I know the governor's been very, very involved. They're in the rooms every day, and hopefully that we can get something. We need to. We're going to buy down the tax rate this year by $77 million, just to make sure that their taxes don't go up like they did last year. Of some towns 33%. So to get it down to zero, well, it takes $77 million to do that. We could use that $77 million to plug back into the middle. We really, really could. We need those dollars. And if we don't do something this year, which again, it looks like it's probably not going to happen. I know some of the leadership in the Senate is talking about pushing this out till after the 2027 election. I hope that doesn't happen, but we're going to be looking at another $150 million to buy down that tax rate again next year. It's just too much money. It's too much money out of our small budget. The dollars that have come from the federal government, the ARPAs and the Build Back Better and all, they're gone. They're absolutely positively gone. We've gone through $15 billion, and we're down to just with what we can produce in the state of Vermont. So we need to work really, really hard on that. There are a couple bills that I really wish that would come forward. One of them is, I know, Jerry, that you're in favor of. The cell phone bill, for right now, it's just dead. They just won't take it off the wall. They just will not do that. I don't understand it. It's a bipartisan bill. And we have all kinds of support on that, and it just won't come off. I mean, the supermajority is no longer there, but the majority, they control the schedule of what comes on. And I just wish it would come off the bill. We would pass it tomorrow. Tax and Social Security. They just believe that they need the money more than grandma. I mean, that's just the way it is. They will not take that bill off the wall. Not taxing military retirement pay. Those are the people, we need people to come here. Don't get me wrong, we all need people, but we need people who are healthier in the prime of their life. Most of them carrying their own insurance, so that we're not a burden on the hospitals. Bringing in the military retirement people is a 7-to-1 return. If we forgive their taxes on the retirement, it's a 7-to-1 return. And those people are calm, they're in their 40s, they're healthy, they have their own insurances, they're working, they're coming on, and so we need those people. We need those people here. They just won't take it off the wall. They just won't take it off the wall. We can't control that. A couple other things that I wanted to talk about. I'm sure they'll come up in the questions, and I want to leave plenty of time for questions. So please don't hesitate to reach out anytime, but we'll talk some more, I'm sure.
Thank you.
Yep, you're welcome.
Thank you. Thank you, Senator Ingalls. Our next speaker will be Representative Nelson, who's on the Senate Committee of the House Committee of Agriculture and Food Resiliency.
And forestry.
And Forestry. There we go.
Well, so the hospital is sponsoring this, and Woodman Page is coming because he's on the House Health Committee, and he's running a little late, so I'll fill in airtime. I got a whole book to go over. So Russ gave a great summary of what's going on with a lot of the bills that are not in my committee. And I'll talk about the bills that are in my committee. S60, that came over from Russ's committee in agriculture. That's the Farm Security Special Fund. We have in forestry in our committee, we've changed it a little bit to the Farm and Forestry Special Fund. And that's a fund we'd like to create for reasons like the 23 and 24 flood. Farmers got wiped out. We are not privy to FEMA funds. Vegetable farmers, it's hard for them to have insurance because there is no crop insurance for veggie farmers. So we'd like to create a special fund. Word on the street is it won't be funded this year, so we'll create the vehicle to carry it. And if there is another July 10th mass flood event, if monies come in from the federal government or if they do a budget adjustment act, there'll be a place to put money into it. We have 3 current use bills on the wall. We were hoping to get some of those through this year. Current use is what changes the tax rate for farmers. By signing up your land, it won't be developed, so you're taxed on what it's used for. But we realize a lot more work to put into those than to just throw them out. You'll get a seemingly simple request from somebody in the community and a great idea for an act, and then you've got to look around the corners and look through the weeds to see what else it'll affect. So there's nothing easy. So these bills we got to work on more if we do. Out of our committee, we sent over to the Senate Vermonters Feeding Vermonters. The administration has cut back on the amount of money they're sending to the states. The ARPA funds have dried up. And we've always funded Vermonters Feeding Vermonters, and that enables the food bank, the Vermont Food Bank, to buy money from local Vermont farms to put through the program. And it won't be funded like it has been in the past because we don't have those ARPA dollars anymore. And they're going to have to tighten up a little bit on what they give out. But we're trying to find, it's over in Russ's committee and they're working on it now. We put out the Molly Beatty Distinguished Service Award for forestry. That was straightforward. That was a quick up and down vote, and that's over in the Senate. I don't know why that hasn't been voted all the way through yet, but that must be a Senate natural. We also sent over an exemption for home food manufacturing, and that's in Senate Health now. And there's always been an exemption if you produce less than $6,500 of food at home to sell at farmers markets or to your neighbors, you were exempt from having to pay for a license. You had to be licensed, but you didn't have to pay for it. And we brought that level up quite a bit more. You know, as I said in our committee, I said, someone making pies for Thanksgiving can hit that $6,500 pretty quick. We also passed the foo-foo dust bill out of our committee and sent that over to Senate Ag. And it's a miscellaneous ag center substances bill. And it's for soil amendments, plant inoculants, all these things that are not fertilizer or lime that are sold throughout the country. And the American Association of Plant Food Consultants Organization, I think that's how it goes, AFCO, they are trying to, they want to get all 50 states to have the same language. And we'll set up a fee structure. I was real excited because finally someone's going to make money off those substances. They charge $20 an acre for that. 2 weeks of sunshine will grow the crop just as well. Two big bills we're working on right now is S45, the Right to Farm bill. We just got a report back updated report on the impact of dairy to the state of Vermont. It's $5.4 billion. $5.4 billion dairy through all the money that comes into farms, the dairy farms, cows, sheep, and goat, that goes into our cheese plants, our dairy processing plants. Is $5.4 billion. We are the big deal in the state of Vermont. We're bigger than tourism. We're bigger than tourism in the state of Vermont. And frankly, unless it's wintertime, we're a reason, and you're a water enthusiast in our beautiful lakes, we are the reason for a lot of the tourism in the state of Vermont. It doesn't give us a right to pollute. We have to follow the required agricultural practices, but it gives us protection from nuisance lawsuits because someone doesn't like the smell of manure, or they don't like to hear your rooster crowing, or they don't like people pulling into your farm stand in front of your house where you sell your veggies at your farm. We also have the rodenticide bill that we're working on right now. And some people really think that we shouldn't use rodenticides to cure our rodent population. I don't want to take another tool out of a toolbox from the professionals that control rodents. I realize, and they changed it last year to make the Generation 2 rodenticides only used under licensed applicators. Because it's just like our weed spray or anything else, we have to use it right, or you have unintended consequences. So they've made these now only to be used by licensed professionals. Let's leave that tool in the box and watch what happens. I think it'll be tightened down quite a bit, because now the agency, if someone's not using it right, they have teeth to go after the offending applicators. That's, I got a whole list of bills over here that we have hanging on the wall. We have a dozen more bills hanging on the wall that we probably won't get to this year. There's been 507 acts or bills brought to the House of Representatives this first year of the biennium. 507. So you wonder why it takes us so long down there? That's what's going on. And Woodman Page has got here, Representative Page, and I can stop rambling.
Thank you. Thank you, Representative Nelson. So you all know there is some coffee up there now, so help yourselves to the coffee.
I'm going to come around with it just so you guys don't have to get up. I'm going to let you guys just sneak around it, unless you want people to serve it. It's up to you.
All right. Sure. If anyone's in dire need, you can run up and get it. You can wait until it comes around, I guess. So we have Representative Woody Page, who's on the House Committee of Healthcare, to talk. Thank you.
Here's so I'm a little disorganized. I just received a phone call from my friend Richard Nelson saying, "Where are you?" And I thought it was at 8 o'clock. I told him, I said, it's 7:30 now. He says, well, it starts at that. So anyways, I don't think I may have broken some speed right or something like that. So anyways, what I want to do is just go over some of the bills that we have passed out of the House Healthcare Committee. And then I'll tell you about the latest bill that concerns me.
You need to speak out, please.
Okay. And I'll talk to you about the latest bill that concerns me and probably concerns our hospital. So these are some of the bills that we have passed out. And some of them are not that bad. An act relating to the Office of Healthcare Advocate. This is just updating the tasks for the healthcare advocate. H96 is an act relating to increasing the monetary thresholds for certificate of needs. This pertains to our hospitals who, every time they want to buy a piece of equipment or do some building construction on their facilities, they have to go before the Green Mountain Care Board and ask permission. Well, we've raised the monetary limit for those hospitals to do those types of things. It's a great deal of paperwork that they have to go through, and also for the Green Mountain Care Board to review and approve these certificates of needs. So I think that's a good thing. I would have liked to have eliminated all of them, but that's something else entirely. H237 was an act relating to prescribing by doctoral level psychologists. This allows psychologists to authorize and give out medication. H259, an act relating to preventing workforce violence in hospitals. This provides a plan statewide, or is enforcing a plan to be performed statewide for all of our hospitals in preventing workplace violence. We're seeing more and more of it, and we want to protect the people that serve all of our health needs. H266, an act relating to 340B prescription drug pricing program. This was to try to control the cost of prescription drugs. H482, an act relating to the Green Mountain Care Board authority to adjust a hospital's reimbursement rates and to appoint a hospital observer. This also concerns me. You're seeing our hospitals have less and less authority to manage their own businesses, and this is giving more authority to the Green Mountain Care Board to control our health care. S18 was an act relating to licensure of freestanding birth centers. Here in Vermont, we don't have freestanding birth centers, and apparently younger women wish to go elsewhere to have to give birth rather than to a traditional hospital. There are a couple of birth centers in New Hampshire that is being utilized by Vermonters, and we've given authority to start establishing birth centers here in Vermont. Whether or not that'll have an effect upon our hospitals, that's another thing. We were told it wouldn't, but here again, I'm skeptical. S27, this is an act relating to medical debt relief and excluding medical debt from credit reports. The treasurer had about $1 million, well, he did have $20 million. Now it's down to $19 million. He's allocated $1 million for debt relief for those individuals that have accumulated medical debt through no fault of their own. And this passed recently. S28, an act relating to access to certain legally protected health care services. This gives providers and pharmacists the ability to not have their names on certain pharmaceuticals, and as well as paperwork. It also provides women greater access to prescriptions via telehealth. S30 is an act relating to updating and reorganizing the health insurance statutes. It's basically, as it says, updating of our statutes. So we do a weekly report to our leadership in our party, and this is what I recently wrote to my colleagues about H126. If I can find it. Well, Health 126 is a healthcare payment and delivery system. It's reforming our entire healthcare system, and it's giving more authority to the Green Mountain Care Board, as I said earlier. It's going to give more positions, more manpower to our Green Mountain Care Board, as well as the Agency of Human Services. Approximately 5 individuals will be hired within the Green Mountain Care Board, and those positions are a staff attorney, of course, one project manager, reference-based pricing, which is what we're moving towards for hospitals to charge, one director, reference-based pricing, one director, global budgets, where there'll be a set amount of monies that will go to all the hospitals, and one project manager for global budgets. That's going to cost us $1.7 million. In addition, we're going to have two other positions with the Green Mountain, or with the Agency of Human Services, and that's going to be $1.5 million. So quite a little bit of money there for this new program. And what else do I have to tell you about it? As I said, the Green Mountain Care Board will establish reference-based pricing. It's a pricing that will cost control measures to keep medical care and premiums down. Blue Cross, and this is the reason mainly, Blue Cross and Blue Shield is on the verge of bankruptcy. People can't pay premiums. If we lose Blue Cross Blue Shield, we're in a dire situation throughout the state of Vermont. So this is why they're moving ahead with this. As I said, this is a payment model where there's a maximum reimbursement amount for each healthcare service. It'll use a benchmark like Medicare. I don't know whether that's going to be a good thing or not, based upon what Medicare rates are for the work that is reimbursed, but that's where they're moving towards. Hospitals and providers will be paid a predetermined price for each service rather than a negotiated rate, which they currently pay for. So I think that's about it. I'm sure we'll be having some questions later on. One other thing, I guess next week, we've received testimony on 126 from the Green Mountain Care Board and the Copley CEO, and then our CEO from North Country, I believe, is coming next week too, Wednesday to also to speak about 126. How open and honest our CEOs can be about 126. Here again, I'm a little skeptical because the Green Mountain Care Board chair will be in the room, or certainly will be watching to see what they have to say. So how honest they can be is up to them, I guess. So.
Now is the time that we open the floor to questions. When you come up, please come here and state your name and the town you're from. You're allowed 1 to 2 sentences to lay the groundwork for the question, and then please ask your question. As always, though, the sponsor gets the first question. So we have Tom Frank coming up with his first question for the legislators. Thank you.
So since it is a healthcare day, I have to ask Woody this question. So another 1.5 for Green Mountain Care Board, 1.7 for AHS. Who pays for that, Woody?
We all pay for it in one way or the other.
Who does it get passed on to? Is it going to be like, right now the hospitals take the full cost of the Green Mountain Care Board, which is about $10 million a year. So you divide that by the hospitals, that's $600,000 a year that's going to support this organization, which means that cost obviously has to be passed on somehow. This is another $3 million, and the question is that going to be passed on to the hospitals again? And so then how do the hospitals adjust for that? Every hospital in the state's different. We're a critical access hospital, we're not UVM. So when you pass $3 million on and it comes to a critical access hospital, that's a little bit different than passing that to UVM.
The money is coming from the general fund.
Thank you, Lee.
Did you want to elaborate any more on that?
No, I mean, that was just one question. It's coming from the general fund according to my joint fiscal office report, and I can give it to you after.
Okay. Either of you want to address that question at all?
I would have been like,
Thank you.
I think Woodman's probably addressed it. just some things about the Green Mountain Care Board. Green Mountain Care Board was set up to take care of when One Pay was going to, or when, not One Pay, but One Care was going to be here. We have an agency within the state government will do the same thing for not $10 million. It's there. It's there. Green Mountain Care Board, you know, I know it all sounds good and control the costs and all that stuff, but I look at things like this. I look at when UVM saw a need and just took in services and made $133 or $134 million by taking in dollars of people that wanted to go do business there. They weren't asking the people to go there. They weren't forcing them to go there. They weren't mandating that they go there. They just provided a service by hiring extra positions so that people could go there and get care willingly. It wasn't the only place they could go, but there was a need for it. But what UVM was able to do after that is they were able to send a couple positions over here to North Country to help them out, because North Country didn't have the need for 5-day a week positions in that area. They sent some to St. Johnsbury. They sent them all over the state to help defray the cost of care when our local hospitals couldn't afford to do it themselves. So they weren't just being these greedy capitalists as far as taking those dollars. They were pushing them out there further. And that's kind of how community should work a little bit. That's kind of how healthcare should work a little bit. If you make a little bit more, you should be able to go and help your neighbor out a little bit and push it out there. Instead, they got penalized and they got fined. And they were allowed to make a little bit of that. But then, of course, then our hospitals suffer. Our NVRH hospital suffers. The other hospitals that out in the area suffer because now UVM doesn't have those dollars to send or those people to send out into the hitherlands to help all of us when we can't do that. So I'm very critical of the Green Mountain Care Board. In fact, it's, you know, a lot of people are calling it the Green Mountain Don't Care Board. And I think it's time that, we're not even allowed to audit them, by the way. We're not even allowed to go in there and look at their books. We're not even allowed to do that. They're not protected. We can't even go in there and we can't even say, well, what do you make, or what do you make, or what do you do, where do you spend your money? Where they're unauditable, and that just isn't right.
Thank you. Representative Nelson.
All your area legislators, Leanne, all of us, have said our hospital is going to stay here. It is a critical care hospital, and I've had some family members in the recent year that are getting critical care at that hospital. And also, my daughter would have been born in a snowbank on top of Sheffield Heights if that hospital hadn't been there, because she came that quick. So I, for one, I've got a little different approach. I've made really good friends with it. Become a really good friend to the chairman of the Green Mountain Don't Care Board, Owen Foster. Just because I think that if you can meet him in the hallway and have a frank chat with him, you learn stuff and you can maybe influence them just a little bit. And I influence them in favor of our hospital. And right now we have our dialysis center there, and we need to keep it there because I can't imagine sending a dialysis patient for treatments, now that I understand how horrid it is, to Albany Medical Center, because there's no place in Vermont open for them to go to. And if you don't have a loved one that receives that type of care, so I hope you don't, I hope you never do, but if you do, we have it here, and it helps, and it's greatly appreciated. Thank you.
Thank you, Representative Nelson. Want to follow up on that? Okay.
Well, I'll just
Thanks.
say a couple of things about the chairman. I like Chair Owen Foster. I think he's very capable, very knowledgeable. He's only been in the position for, well, maybe a year and a half. Previous chairs, I do not think have looked after our healthcare system that well. And that's perhaps why we're in this particular problem that we have. I would agree with everyone. We wouldn't be here if it wasn't for our North Country Hospital and the people that work there and the people that have, brought monies in to build that hospital from the previous hospital that we had earlier. And I'll just go over here some of the issues that our hospital will be required to report to the Green Mountain Care Board that's out of 126, S126. You'll have to know your depreciation schedules on existing buildings, a 4-year capital expenditure projection, a 1-year capital expenditure plan, the number of employees of the hospital whose duties are primarily administrative in nature, and the number of employees whose duties primarily involve delivering healthcare services directly to hospital patients. When I heard this, I mentioned it sounds like Doge to me. Information regarding base salaries and total compensation for the hospital's executive and clinical leadership, and it's for its employees who deliver health care services directly to hospital patients. Proposals for ways in which the hospital can support community-based, independent, and non-hospital providers, including mental health, substance use disorder treatment providers, primary care providers, long-term care providers, and physical therapists. Our hospital already supports our community in a number of ways that none of us probably realize in the long run. These are the types of, and I could go on, there's several pages, and that's what we're dealing with. And again, I'm really worried for our hospital. A lot of this, I think, is directed towards the UVM Medical Center Health Network, but unfortunately, and UVM, or the Green Mountain Care Board, has the authority to do some of these things, and our hospitals have been cooperating with the Green Mountain Care Board, but now they want it in statute. And again, it worries.
Thank you, Representative Page. As those of you who may have heard, there's a couple items that are gradually finding their way out here. But while that's also happening, I'd like to open the floor to the next question, if anyone would like to come up and ask a question. Oh, Senator, her hand first. And just remember to speak loudly.
I can speak loudly.
There you go. Awesome.
I'll lead with a question because it makes you feel better too. The question is, for all of you, first of all, I want to thank you for everything that you do for everyone in the Northeast Kingdom and Vermont. The question is, if federal funds disappear and it's October, how are we, as a very rural area, how do we count on your support in how do residents of the Northeast Kingdom get their needs met? So the president's budget that was leaked last week eliminates Head Start, it eliminates the low-income heating assistance program, and the community service block grant. And to give you a little framework, we have 170 children and families that receive Head Start. So that would be 170 to 190 children and families without child care in the Northeast Kingdom. There's over 600 households that receive low-income heating assistance that would not have heating. And the Community Services Block Grant for NECA pays for all of our food programs, so the food shelves and the staff throughout the entire Northeast Kingdom that you represent.
Thank you. Thank you for the question. So we'll begin with Senator Ingalls.
So I would say this, we'll be in a world of hurt. Plain and simple. So get hold of Becca, get hold of Bernie, get hold of Welch. They're the only ones that can make the difference. They're the only ones. There's nothing that we can do. There's nothing we can do in the state. It's federal dollars. We don't control it. Those are the three people that you should be talking to, and because we do not have the funds to do any of that. So that's all there is.
Thank you, Senator. Representative Nelson.
$77 million we just spent to buy down the Ed Fund. That's money that we can use for these programs. Absolutely. It's a concern in our committees. We talk about food security all the time in our committees. $1.2 million we lost for Farms for Schools, to feed schools and Farms for Schools childcare. That was another $500,000 on top of it. Money was stripped away. Hopefully it comes back. You watch, the governor says, and I really believe this, don't panic until it's time to panic. You know, they tend to clear stuff off with a D8 bulldozer in Washington these days, then they put it back with an excavator. I'm really hoping that's what happens, but it is a big concern. It's a big concern of ours. It's a big concern of the governor's. That's why the governor doesn't want to spend all our money in the Budget Adjustment Act. He keeps saying we need to hold these dollars in reserve to see what we're going to need. So that's, yes, right now, Senator Ingalls is absolutely right. It is out of our hands right now. We got to sit back and watch, reach out to our Washington delegation. I'm sure they're getting emails. They know about it. We just have to watch and see, but let's not be spending our money. There is a bill in House Natural to spend money on a study to bring back the catamount to the state of Vermont. I don't care if it's $30,000, $100,000, or $10,000. We don't have that money to spend. We need to hold these dollars in reserve so if we have an issue. So you want to send a letter? Send it to Representative Sheldon in House Natural saying, quit wasting dollars. We need to hold on to them because we're going to have need for our children and our most vulnerable population.
Representative Nelson, Representative Page.
In all of our committees, we're asking the individuals that report to us, our secretaries and our commissioners, what their plans are. Apparently, they are working on plans if there are cuts. They are in discussions with their colleagues in Washington, D.C. And every time they come in, we ask them what the plans are and where they're going. If we lose this money, we're definitely going to have to, tighten our belts, and there are going to be some things that are going to be cut, unfortunately. We're either going to have to cut some things, God forbid, we're going to have to raise taxes. Just take a look at what's happened to Maine recently. Some of their funding for education and Medicaid has also been cut.
Thank you, representatives, for those answers. The next question, please.
I don't need to be on camera.
Well, you have to come up and state your name and where you're from, please.
If he comes next time, can we have him sit up front? It takes him half an hour to get up.
We definitely will. We'll let him.
My name's Paul Brew from Derby.
Thank you.
Russ, this taxing veterans' pensions is embarrassing. Apparently there's only 2 states that are doing it, and we happen to be one of them. What are you thinking? If we owe anybody anything, it's those people. I got a magnet on my fridge. Land of the free, because of the brave. And these guys deserve it. What is going on? Apparently there's a bill there somewhere that ain't going anywhere.
Thank you, Paul, for the question. Senator Ingalls.
There is a bill and it just will not come off the wall. And there's a bill not to tax Social Security. It won't come off the wall. It's just as plain as what it can be. So if we can put any pressure on them, it's in finance, and they just will not take it off the wall. They just won't. They
Keep the wall down.
one person's making that decision, by the way. One person in government's making that decision. One person. One person's made that decision for 7 years. And that's just the way it is. They will not take it up.
Which person?
Ann Cummings.
Representative Page.
I went to Norwich University. I received a commission in the Air Force. I spent over 22 years in the military, retired, and was active duty. My son recently retired as a full-bird colonel. There are a number of Norwich cadets, and not just Norwich, but UVM. They graduate ROT students. Those individuals that stay in the military, make the military career, they're not coming back to Vermont. And these are the type of people that we should be encouraging to come to Vermont. People that have resources, people that have families, people that are younger and can, start businesses and help our economy grow. These are the types of individuals we would like to recruit and bring here, but we will not recruit those individuals. As an officer, retired officer, this bill doesn't affect me. I'll be fine. But what does concern me as an officer is my enlisted force, our enlisted force. Those are, basically the workforce of the military that do all the crappy jobs sometimes. And I think they deserve retirement, free pension retirement to attract those individuals here. We do have some military members here that were in the Guard, retired out of the Guard. I just spoke to somebody recently. He was kind of like a double dipper. He retired from the Guard, or he was a double dipper. Retired from the Guard and then started working at Customs as soon as he retired. He's now retiring from the Customs. I asked him, are you going to stick around here? And he says, well, my wife and I have had conversations about that, and we're going to South Carolina or North Carolina. I can't remember which. It's because of the taxes here. So, till we do something about this pension program, not just for the military, but also for the Social Security, it'll be damn hard to attract people here.
Representative Nelson.
I'll try to be quick. The food's there. We're going to take a little break, y'all. Freshman caucus got together last week, and one of their top priorities of the freshman caucus is to get this bill over the finish line. That's a bipartisan caucus of all freshman legislators. It has strong bipartisan support in the House, and there is just one or two people holding this bill up. Also, the relaxing the taxes on your Social Security, it will be a tiered approach, a stepped approach. The governor said, get it across the finish line, we will figure it out. People say, well, we ought to give pension relief to people, to first responders and to other groups. Perhaps we should, but we need to start someplace. Let's start with the people that have put themselves in harm's way so we all can stay home and do what we do. So to me, it's a logical first step. And it's almost de minimis, the amount of money it'll take out of the budget. It really is de minimis. Thank you.
Thank you. And so, unusually, we don't do this very often, but the food is here. We are going to take a break for a minute or two for everyone to get some food, and then we'll come back, and there's going to be time for 2 or 3 more questions after. Okay? Thank you all.
I've got nothing till noon, so I can stay here.
All right. We'll keep you busy.
I got over being asked. There you go. I was about 12. Senate
I don't know if everyone can hear me. I'm a fairly new Vermont resident, and my husband and I are very concerned about the hospital. I keep seeing signs to keep our hospital open. Is the hospital in danger of closing or not?
Excuse us.
Am I allowed to?
I think Mr. Frank got to go up there.
Yeah, okay, Mr. Frank.
So the short answer is absolutely not. We're not closing. There was a report that was produced by a consultant who did a half-assed job, excuse my language, that made several recommendations about departments in the hospital based on a 2-year financial struggle we had on something that was out of our control. That's been repaired. We actually our hospital's actually in one of the most strong financial positions any hospital. So no, our hospital's not closing. No departments are closing. The rally that was held downtown on Saturday, they're just trying to support healthcare in the Northeast Kingdom. And of course, the hospital tends to be the center of that healthcare world. But again, no, we are not.
Thank you.
Thank you.
I just want to add something.
Yeah. Senator Ingalls.
That goes kind of back to what I had said about the Green Mountain Care Board. They're supposed to be leaders. They're supposed to be leaders with ideas. They're supposed to be the people that come with great ideas and come work and collaborate with our hospitals. Instead, they spent $5 million on this study and scared everyone and came up with inconclusive, not even realistic, possible goals or aspirations or thoughts, and caused a bunch of angst amongst our community, which I take very personal. Because it wasn't anything that was based in reality. This Green Mountain Care Board should have never even commissioned such a study like that. It's not even, there's so many more important things to do and so many different ways that they could have spent those resources and been a positive influence versus to make up something like that. That, damn, we struggle up here in the kingdom about, somebody heard this and somebody heard that, and then off it goes rampant. And I can tell you, these people over here have a lot better things to do than to try to counteract that type of stuff right there. And everybody says, well, anybody wants to be a naysayer about it can say, well, yeah, but well, really, what's it mean? It was a bad report. Well, here's what it means. It means that when they're in competition to recruit people to come to Siberia, because we are a little bit up in that area, and people like that, they have to give more, because they have to counteract that report that was erroneous to begin with. They have to work 10 times harder to overcome something that wasn't factual, basically on an expensive room. And I commend them for how hard they're working on it, but they should have never had to happen. They should never have had to defend themselves against something that was unrealistic.
Representative Page.
The civil rights movement had a saying, keep your eyes on the prize. Well, I would say the same thing about our hospital. They're using the Oliver Wyman report as a baseline where they go from here. So don't let up on your support of this hospital. And that's all I have.
Representative Nelson.
We need a few more studies to spend money on everything. They always have to have a study. And the next great boondoggle study, besides the Oliver Wyman report, will be the study on education that they study and restudy and restudy. And I really think that you could take Representative Harple and Conlon and Senator Beck, and then maybe a farmer that's in the House and a few other people, and put us in a room and say, solve education. It can be solved. Realize that we're not going to make everybody happy, but we could solve it so we can all afford to live here. It's the same with our health care. Every time they have a study, they have to reinvent the wheel. They were forced into using a computer program that cost you how much? Come on.
Ultimate loss of $18 million.
There you go. Let's have another study.
Thank you. Our next question.
Ed Barber, Newport Daily Express and Derby resident. The question is going to be issues of agriculture. Vermont has a reputation. We know one of the major things that people like about Vermont is the dairy industry. They come up here as tourists, they get to go out in the countryside, see the cows prancing around the fields. But we got a problem because we don't protect our own brand. The question I have is going to go to Richard and to Russ is, right now you go in the grocery store, you go to the dairy section, and what do you see? Almond milk, soy milk. Products have nothing to do with dairy, yet they're allowed to label it as almond milk. It's not milk. It does not have the same nutritional value. There are some states to combat this have decided to require that you put up a poster in the dairy section where you're going to distribute almond milk and these other non-dairy products in there, but they have to have a sign that says this is not a dairy-based product and it does not have the same nutritional value. I'd like to know from our delegation here if they would consider supporting a bill that would do fairness in labeling the milk products that we have here so we can protect our dairy industry. Nobody milks almonds, you milk cows.
Thank you for the question. Senator Ingalls.
The dairy industry is very huge in our state. We're very well aware of that. As Representative Nelson has said, it's $5.4 billion. At some point in time, we're going to have to make a decision about how we want to support our farmers. And there are some ideas out there. There's a idea that I've put out there, and we'll get there at some point in time when we start talking about what's important in Vermont, which is this. We need to make sure that farmers are paid. We need to make sure that farmers can stay in business. The average age of a farmer right now is 60 years old, 58 years old. They're a dying breed, not to coin any type of phrase. I think that there's support amongst folks that if they knew that they were supporting the farmers directly, that they would be in support of it. And my idea has been that anything that acts like dairy or anything that's dairy in the store, that we put a surcharge on it, like 3 cents or 5 cents, and it would go directly to the farmer. Every bit of it. And that's anything that acts like a dairy product, margarine, soy milk, fake cheese, regular cheese, all of that stuff. And Vermonters are a very caring bunch, a very resilient bunch, and they understand what dairy does for the state of Vermont. They understand what farming does for the state of Vermont. And I think that if we could formulate a plan like that, we could get our farmers up to a base pay of dollars that would keep them sustainable and let them, there was one true thing about it, is that if you give farmers the monies, they'll spend it, and they will. And it will help their economy, it will help them keep viable. And, Richard had kind of touched upon about what farmers do for the state of Vermont, but think of what they do for tourism in the state of Vermont. There isn't a picture of, there isn't anything that isn't advertised in the state of Vermont. There's a dairy cow, there's an old silo, there's a farm, there's a field, there's green fields, there's cornfields, there's cut fields, there's tractors, there's a maple field with a maple tree with a bucket on it. I mean, our identity in this state is farming. It really is, and we just got to do everything that we can do to do that. Yes, to answer to Ed's question is, yeah, we certainly would love to have a bill in there, but I think we could do even better than that. I think we could do something to make sure that our farmers were sustainable for the rest of their lives and our lives.
Thank you. Representative Nelson.
Milk is a secretion from a mammal that's had one or more babies. Strike Webster's dictionary. It's tried and true. Nut sweat is not milk. Just that simple. The USDA has been petitioned several times to enforce the definition. You know, they don't want to call it oat sludge, I guess. So that would be a start. We also would start that right here in the state of Vermont. But when you do that and it's not nationwide, now all of a sudden you got packaging restrictions and whatnot. And there are people out there, there's a segment of the population that can't enjoy dairy. They have lactose intolerances, although there are dairy products now made to correct that issue. So yes, Ed, I do support removing those items out of the dairy case. Vermont is more dependent on agriculture per capita than any other state in the country. And this is why we're working on the right to farm bill. And it's not just for dairy farmers, it's for everything. It's a struggle, but I'm glad to hear, Ed, with your report, Russ, or whoever said the average age of the farmer is 60 years old, because I'm going to be 62 here shortly, and I'm finally above average.
The next and probably final question.
So my name is Ed Nelson. I'm from Derby Line. And one of the concerns that I have is about the homeless population here in Vermont. It's a fairly high percentage per capita. So we live just not down the road from the hotel or motel there around the Derby Community Church with the motel voucher system, which I believe has failed. So I'm curious now that some of these changes that are being made and some of the folks that are under that motel voucher program are being forced out in April, what the legislatures are planning to do and not have it just be a Band-Aid on the problem, but really solve homelessness in Vermont.
Senator Ingalls.
Thanks for that question. I think first you gotta find out what the answer is to homelessness in Vermont. What we're finding is that, and it's not all of them, please understand that I know there's homeless people in Vermont. When they started at the beginning of the year, January, a bunch of people were exited from the program. Most of them went back where they came from. There are still some folks out there that are struggling. There are some folks out there that we have to get housed. This last group that went out there, a lot of them went back where they came from, and they really, really have. But it doesn't mean that they're all there. I know that when Massachusetts and New York cut their programs after COVID, we got a good big influx of folks that came into Vermont, and that's just the way that it is. I think it's 93% of the people that are in the motel-hotel programs, and they're not all of them, please, I know, but most of them had come from elsewhere because of the programs that we were giving that were free, and they really, really were. We have to be mindful that there are people that are less fortunate than us. I spend my life doing that. I do a lot of things that people just don't understand. There's a few people in this room that do understand what I do and what I care for and what it is. I don't want people living in tents. I don't want people, I want people that are left by the system. I want people who are in addiction, who have problems, that are struggling. I want them cared for. But I also want to be able to go in there and I want to be able to help them. As the way this program was working before, the hotel motel program, we couldn't even go in and we couldn't even ask them, how can we make your lives better? What can we do? Why are you homeless? Why are you here? All we had the right to do was keep on paying. That program, as you said, was a failed program. For most, it helped some, but we lost 144 people in there. In that, We have to make sure that we don't leave people behind. We always have to take care of the people less fortunate. We have to take care of people that are less fortunate. We just have to make sure that, and I get it, when I said there's 93% of the people that are coming from out of state, well, we're compassionate enough about that as well. We just can't say, hey, here, you park here, but we can help you and we can get you there. We manage about, I shouldn't say manage, but in one of my businesses, we manage about 150 apartments. There is an all-time a 20 to 25% vacancy rate as far as in those apartments. We have homes, we have shelters, we have rental capabilities, we have all of that. The problem is that a lot of the people that are in the hotel-motel program, they have issues more than it's going to allow somebody to want to rent to them. We have to make sure that we get them into treatments, whatever that there is, mental health. We just put it in the front porch for them. Journeys to Recovery is doing a great job. Ben's House is doing a great job. In Derby, we're working on another project as far as to help people through addictions and all of that stuff. Mental health, very, very huge. The pandemic was not kind to people in this state of Vermont. We cannot forget the less fortunate, and the hotel-motel program needs to wind down. I think when it's all said, I think there's 1,100 families that are in there now. I think that when it's all said and done, the real number of homelessness in the state of Vermont is probably half of that, and that we can manage amongst ourselves. We spent $700 million on the hotel-motel program. $700 million. Why did we spend that? It's because we had those federal dollars and we just spent it like it was going out of business. Imagine what we could have built with $700 million.
Representative Page.
Well, I'll just reiterate what Senator Ingalls said. The homeless hotel program has been a failure. I think it's hurt our downtowns, which had hotels or motels. You don't see these individuals going to JP or some other resort for housing. They're going into our downtowns. We do have an obligation to help those that are less fortunate. And it appears as though the state would like to put that work onto communities, designated agencies. I'm not so certain that that's a good idea. I don't think our communities and designated agencies have the funding available to do that work. I think it's a state responsibility. The state should step up and do what it has to do.
And with a final word, Representative Nelson.
Because he is the word.
Glad I got over being bashful. We have spent, as Russ said, $700 million on the hotel-motel program. We could have built a lot of houses. And the governor said it, we have said it, we are working, we have several housing bills on the wall. Remove some of the restrictions. The Tier 1A, 1B program, when that's up and running, Newport, Derby, we have zoning and planning in those towns. It'll take Act 250 right out of the equation. If it goes through the local zoning and planning, it's good enough for the state, and it should be. It should be. Those of us that live in Derby should decide, how we develop Derby. Not someone from St. Johnsbury, which, goes back to the school issue. We don't want our district so big, someone from St. Johnsbury is deciding what we do in Glover. So that's where we need to invest, and it's not just affordable housing, it's entry-level workforce housing. And build it, and they will come and they will work here, and we'll be able to employ more people, which will raise our GDP, which will raise our income in the state, and we'll have more money to take care of people. I talked to Elliot Spates just about this issue a month ago. And I said, we need more affordable housing. She said, there's no such thing. We can't build it. And I said, what if you got a grant to build affordable housing? What if you got $5 million grant to build affordable housing up here? What could you do with that? She said, get out of my way, I'd house a lot of people. But she said it, they need services. They need services. We need to take care of these people. And as Senator Ingalls said, what's the deep root? Why? Some people it's health. Their health conditions are so poor that they're not going to be in the workforce. Some people, hey, have a job that pays you $20 an hour. Pretty good money 10 years ago. 40 hours a week, $800, $40,000. Now go have a rent that's $1,500 a month. It's really shortened, and have a car so you can drive to work, and then your car breaks down, and that's why we have to have Vermonters feeding Vermonters. I'm all about the hand up, and we need to work more on our hand up skills. Great question, thank you for that.
Thank you. And so this concludes the legislative breakfast. I'd like to thank you all for coming. I'd like to especially thank the hospital for sponsoring it. I'd also like to thank the members of the media for being here and NEK-TV. And I'd like to especially thank our legislators for coming here and being part of this every time.
If you go to